Hey guys, Dr. Max and Dr. Candice,
Hi,
once
everybody.
again from APM Sports Chiropractic. Coming back this time from my office, so it's a little bit different background. That's why you got to see Ken Griffey up behind us and a couple of Celtics and Kemba Walker, things like that. But today we want to talk to you about what to expect on your first chiropractic treatment or first chiropractic exam and treatment. So what we want to talk about is just the things that you're going to see when you first visit when you come the first time to a chiropractic office, especially our office. So first things first is you're going to come in and you're going to fill out an intake form. If you haven't done it online, some people like to do it on paper still, but you come in, you fill out the paperwork. After that, we do an extensive history, which what history is. We get a little background of what's actually going on, specifically to your complaints, or whether it's neck, shoulder, whatever it is. We ask questions specific to that to help us guide us down the road to see what your diagnosis is going to be.
Yeah, one thing to jump in on that is, one thing we like to ask our patients is, what is your goal out of treatment? What do you want? You know, we hear from a lot of patients that they don't really know what they want or what to expect. So by asking, what they want, and that helps us dictate care as well.
Yeah, and then sorry, then we go into the exam, and the exam is a little bit different from what you might go to your primary care physician, your PCP. So ours is a little more active than passive. So there's a lot of movements you're going to be going through. We're going to look at your posture. We're going to look at your range of motion. Look at all your joints and see how you're moving. Joints, muscle, nerve. Depending on what is exactly going on with you, that's how it's more specific to you. So it can't say this is exactly what you're going to get versus someone else. It's not a cookie cutter thing in our office. It's something, everyone's different. Everyone gets their specific exam. Once we go through the exam, next we're going to let you know if this is a good fit. So once we kind of get all the information from the history, which the history gives us, usually we can figure out, about 80% of the time what your actual diagnosis is just from your history, getting all those questions that can kind of guide us along the road. Once we figure that out, what we think your diagnosis is, we're going to let you know, is this a good fit for you? What we'd like to tell people is we don't have people here if you're not a good fit in the sense of you might need to go see an orthopedic surgeon, or you might see someone else or something else that might benefit you a little bit better. We're not going to keep you here unneeded. So that's why we're going to bring you in and let you know what we can do for you. So that's what we're going to do for you there. And Dr. Candice can talk about treatments next.
Yeah, so then, once we let you know what's going on, we tell you the different treatments that you may go under. Some people don't get all the same treatments here. We tailor it to whatever your needs and goals are. So one thing we're moving away from using so much is electric stim and heat. Old school, like chiropractic in the 80s and early 90s, everybody got pretty much put on stim and heat, and now we're kind of moving away from that just because the research isn't so much reporting it anymore. Other treatments we do here, like we always say, the tool, the instrument-assisted soft tissue mobilization, of course the chiropractic adjustment, flexion distraction, which is the table that bends down that people with tight backs love, laser therapies, other treatment that we offer, custom orthotics. So we run through the treatments that would be beneficial for what your condition is. Another thing is cervical traction. Not many people in our office get that because we don't see a lot of true cervical disc injuries or issues. A lot of times it's more muscular and joint. So people probably don't even know that we have cervical traction here because they've never seen it. But some people have gotten it. And one thing we do offer too is on the second visit, if you're interested, is we can do the Move Well 3 movement screen that we offer here. And what that does is it points out any dysfunction by putting you through these specific movements. We can see what muscles aren't firing and can come up with a detailed rehab plan for whatever your specific needs are. So some people like that just to help them in everyday life. Some of the athletes like it, even if they're not in pain, because it helps see where your dysfunctions are, and by correcting those, it helps you in whatever sport or whatever your athletic event is. So that's pretty much what to expect on your first visit. Patients are usually here for about an hour or so. By the time paperwork's all done, we run through the exam and tell you what's going on and get you your treatment. So I don't know.
Yeah. That's about it. Like we said, that's what we wanted to let you know what that first exam, because a lot of people get nervous about that first exam, what it's going to be, how long it's going to take. I'm going to have to fill all this paperwork, and we just want to let everyone know what you can expect on that first exam when you come to our office at APM Sports Chiropractic. All right, guys. I want to say what's up to Jeff DeMeo. He's actually watching
hey,
live.
Jeffy.
What's up? But yeah, that's it. If you guys have any questions, once again, just hit us up in the comment section. Let us know what you might want to see a video on. You can follow us here on Facebook. You can follow us on Instagram at APM Chiro. Yeah, and we look forward to hearing from you and see you guys next week.
Yeah, definitely let us know if there's a topic you want us to cover, because we're going to be doing these weekly, so give us some ideas.
All right. Thanks, guys. Have a great day.